Hi, everybody. My name is Dr. Dhaval Desai. I'm a member of the Medical Association of Atlanta and now a direct primary care physician in the metro Atlanta area. Previously, I was part of a large healthcare system in Atlanta as a hospitalist and a leader. The Medical Association of Atlanta's latest webinar today comes right around the time of National Physician Suicide Awareness Day, which is on Wednesday, September 17th, and it's part of a campaign to prevent physician suicide. It's staggering to think that approximately 400 physicians per year die by suicide in this country. I'm joined today by Dr. Stefanie Simmons. She's the Chief Medical Officer of the Dr. Lorna Breen Heroes Foundation. She's also a board-certified emergency medicine physician. Just a little bit about Dr. Simmons. She was a primary advisor to the National Institute of Occupational Safety and Health for the Impact Wellbeing Guide for Healthcare Leaders. She has led multi-state programs to improve the operational environment of healthcare workers, and more importantly, remove the barriers to mental health care. And these days is a very well-known national thought leader on this topic. She also previously served as the Vice President of Patient and Clinician Experience for Envision, roughly working with over 26,000 physicians and bringing her influence on this very important topic. She is very involved in the Dr. Lorna Breen Heroes Foundation, which we'll talk more about today. I am so excited that she's here, and I'm grateful also to call her a friend. Hi, Steph.
Hi, Dhaval. Nice to be here.
Thank you. So in the next 30 minutes or so, we're just going to get right into it. You and I have chatted for a while about this, working with the Dr. Lorna Breen Heroes Foundation. Many in our community know about the foundation, but I think it's important that we start fundamentally just going over what is the Dr. Lorna Breen Heroes Foundation and how does it impact physicians in our area and around the country?
Thanks for the question, Dhaval. And to answer that question, I want to start with where the foundation started, really rooted in the voices of healthcare workers. So in 2020, Dr. Lorna Breen was an emergency medicine physician, chair of the Department of Emergency Medicine, caring for patients in New York. During the first wave of the COVID pandemic, she was caring not only for patients, but for her team as a leader, and for her community. And she ultimately contracted COVID, went back to work 24 hours after her fever broke, like so many did, became emotionally, physically, intellectually exhausted. I think we all have a visceral memory of the pictures coming out of Manhattan that spring. And was evacuated really to Virginia, which was her home, to receive her first ever mental health care. And had a chance to talk to her family afterwards and express her concern that now that she had accessed mental health care, her job was at risk, her credentialing was at risk, her licensing was at risk. And ultimately, Lorna died by suicide. What happened next was that her story was shared in the New York Times 12 hours after her death, like the very next day. And first dozens and then hundreds and ultimately thousands of healthcare workers reached out to Lorna's family in the wake of her death and of that article, saying Lorna's not alone. We face barriers to mental health care too. Mental health is a burden for healthcare workers. Burnout is a burden for healthcare workers, and this didn't start in the pandemic. This started well before. And so her sister and brother-in-law, Jen and Corey Feist, started the foundation not as a momentary honoring of Lorna, but really as a movement in response to those healthcare worker voices in order to help create a world where seeking mental health care is universally viewed as a sign of strength for health workers and where the environment of care helps prevent burnout, not cause it. So that's the global work of the foundation, and I'm happy to dig down on exactly how we do that.
Well, no, that's really good overview. Bringing up the New York Times article, that summer when I read that article, and every time I hear Dr. Breen's story being told again, reading that article, I still think it's a very powerful article for anybody to read, because each paragraph, as I read the details of what she was going through and navigating, I had a visceral reaction and felt that could have been any one of us. And it was a big wake up call to me. That pandemic was such a weird time to think back on. I think there was a lot of adrenaline that first surge, but that second surge, that summer, when we really realized that this is not ending anytime soon and society was in complete chaos, there was a lot of healthcare workers struggling. And you're right, the topic of burnout has been talked about for years. And I would say at times a lot of talk without a lot of action, but it's nice to see that the foundation is really putting forth that action. Yeah, when we talk about physician mental health, physician burnout, physician suicide, it's kind of important to take a step back and talk through what does that really mean? For the stories that you know in your career, not only professionally, but through the foundation, the stories of suicide, do you think the majority of those were something that could have been predicted, or they something that were rather sudden and unpredicted? Like we would have never thought this physician was struggling.
Mhm. You know,
And
Deval, it's really hard to know what's happening inside of a
yeah,
person. And healthcare workers and physicians in particular are very good at masking, um, because we're trained to actually mask, right? To compartmentalize. Um, Even when you're having a horrible day, you've just had an awful experience with a patient, or you're physically ill, or you're mentally ill, right?
yeah,
We compartmentalize that so that we can care for patients, and we're trained and we practice to do that. So, so physicians who are in distress are often also very good at compartmentalizing that. There is there is a complex relationship and conversation around burnout, mental health conditions, and suicide. And I think what's very clear is that for physicians, they are related, right? But not necessarily predictive.
that's a good
So
distinction.
there was a study last year looking at physician suicides across the country. And what they found is that physicians who die by suicide are more likely to have encountered difficulties at work or to have pre existing mental health conditions than other individuals who die by suicide.
Hey,
Okay, so from that perspective, you could say if there's a physician who's having trouble at work or who has an existing mental health condition, they are at increased risk of death. Okay. And so that's the type of data we have. And I will also say that physician suicide data is very difficult because this is death certificate data,
correct.
right? And there is no national registry. There is no predictive measurement. We do know that a significant number of physicians higher than the background population experience suicidal thoughts, and that deaths by suicide for female physicians are at least twice as high as they are for other women. Um,
Mm,
Now, to your question, burnout as a occupational syndrome
right. That's how
is
I think of it.
yeah, is really this combination of a mismatch between work demands and work resources, and then a moral injury, right? Like the injustice that is personally felt of having to act within a system that prevents you from living out your deeply held values. So there's the death by a thousand cuts, the pebble in your shoe, right? The work demand resource model, but there's also this very mission driven individual who experiences pain at
Mm.
not being able to fulfill that mission in a deeply flawed system.
And I want to piggyback on that. So it's very important that struggling at work does not mean disruptive physician or a physician who is maybe not up to date on the latest clinical guidelines and having adverse outcomes. It could be that physician who had some sort of unfortunate event, and is now the second victim after an adverse event. And those are the ones that hit me the hardest in my previous leadership role, and I've experienced myself. And that's, to your point, it takes away from, we go down a rabbit hole of, our mission is gone, what am I doing? It's a very unfortunate, rude awakening when that happens, and it happens to all of us, including me. And I think we're slowly starting to get better at supporting that in real time, acknowledging that second victim syndrome does exist. But oftentimes, truth be told, I still feel physicians, frontline physicians, are sort of pseudo expected to maintain composure in those moments. And we still have a lot of work to do on that.
Mhm. Right. There's two concepts there I'd love to tease out. One is the concept of maladaptive perfectionism, and the other is around compartmentalization.
Let's
So,
do that.
with the selection process for medical training, and then the training process itself through medical school and residency and fellowship, if you do a fellowship, and then the risk and litigation world, there is an expectation of perfection
Yes.
at every step of the way. And there is a time and a place for that. If you're writing orders on my child when she's in the ICU, I want you to be perfect. I
Of
want those
course.
orders to be perfect, at least,
Of
right?
course. Of course.
And there is ideal or as perfect as possible performance versus perfectionism as an individual. And as ideal as possible performance is not purely an individual trait. It's a systems trait, it's a team trait. It requires an environment that optimizes the outcomes and doesn't just rely on individual excellence. So
Mm.
this is the Swiss cheese model of a medical area.
Swiss cheese
Right?
model.
Yeah, you can't just rely on the excellence of an individual for a good outcome. You have to have all of the different pieces of cheese, right? All of the
Yeah.
different possible
Yeah.
holes plugged so that there's outcomes that are as perfect as possible, because it turns out physicians are human beings. I know this is going to shock everyone who's listening, right? No,
It's true.
it's true. It's true. We are, and we're never going to be perfect. When we expect ourselves to be perfect, and when our teams and our systems expect ourselves to be perfect, we are set up for failure, both in the performance of our duties and in the aftermath. So this idea, this maladaptive perfectionism, which is placed on us and which frankly we place on ourselves as well, is a great source of harm.
It's a powerful term, maladaptive perfectionism. I'm learning with you today. I really am.
So I can't take credit for it. I was just at the
Okay.
conference on physician health, and I listened to an amazing talk on maladaptive perfectionism
Yeah.
by Stuart Slavin, who's in charge of wellness for the ACGME. And so, this was a concept that has been core to my thinking around adverse medical events,
True.
litigation, peer support for years, but he really uh, condensed that
Yeah. It brings it home into one concept. It's great.
right. So the other idea is really around compartmentalization, because you said we're expected to
Yep.
keep it together in the moment, and we are. I mean, I'm an ER doc,
Yes,
so
I do.
yes, there can be something horrible happening in front of me, and I've got to be able to keep it together. So you like take that, you package it, and you put it in your backpack, right? And then the thing is, a full shift of those packages is pretty heavy. A full month of those packages is exhausting. And years of those packages can land you on your back with a backpack so big and so heavy you can't stand up again unless you unpack and process
Mm.
all of those packages. So it becomes a need that we have to have the process by which to uncompartmentalize process and integrate those experiences into our future identity and our future actions.
Yeah,
But compartmentalization is, I mean, it's a critical skill. We have to be able to compartmentalize,
absolutely.
and we get taught how to do that and not the opposite.
It's true. Speaking of wearing masks and compartmentalizing, I thought I was doing a pretty good job of it until the pandemic all along. And we had our second child 2 weeks before the country shut down, accompanying a 4-year-old. My wife, also a physician, her maternity leave turning into everything that it shouldn't have been. And I remember, trying to compartmentalize what I was dealing with at the hospital, leaving it there, and then coming home and trying to be present with my then 4-year-old and newborn. And I failed miserably many days. And it was a rude awakening to me, that when I wanted my daughter, all she wanted to do was me to teach her summer of 2020 how to ride her bike. And that was daddy's thing to do without training wheels. Maybe 4-year-olds is too soon, but a lot of her friends were doing it. We're all in. So I remember being outside doing it with her and saying, pedal, pedal, pedal. And she'd get one pedal. But can I tell you, and I've shared this story everywhere, that I failed to feel the joy. All I wanted to do was go inside, lay down, and just kind of unplug and detach from everything. And that's when I knew that I was struggling. And it was right around the time when I read about Dr. Breen's death, and everything that was going around. And it was a wake up call for me. And I share this because I hope that other listeners who are physicians and healthcare workers out there can know that, we all are good at wearing masks. When I finally started sharing my story, most of my team was like, there's no way you're struggling. What are you talking about? And it's like, nope, 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 you have no idea. So it's very powerful on that. The other thing that's helped me, and it's not about me, but obviously I've approached it from a organic standpoint with medications, but I've also found a really good therapist. And I have to drill down the point when we're unpacking from all the compartmentalizing we do. Therapy is so powerful. Would you agree?
Absolutely. Absolutely. And I mean, frankly, I think it should be a part of everyone's preventative health routine.
I agree.
You are experiencing stress and trauma, and let's be clear, everyone in healthcare is experiencing stress and trauma, then prophylactically seeing a therapist to process that stress and trauma should be part of your healthcare routine. Certainly, once you're at that point where that backpack is too heavy, right? Where it's impeding your forward progress, and most, if not all of us have been there, then having a professional to help you
Yeah.
and to also help you to develop the skills to do that unpacking and processing on a more ongoing basis is critical.
And I wish I had done it sooner. Dr. Wayne Sotil, who I know you know and we've heard around speaking, he's phenomenal. I can't take credit for this, but he talks about, there's maybe an illusion that medical students going into medicine come from sort of an ivory castle, this amazing upbringing, all resources in the world, no pathology. And it's actually quite the opposite. The majority of us don't. And there's as you said, we keep going and going and going to a point where it is not sustainable, and we are human beings. Um, and then I will share openly that regarding a therapist, I have seen 2 or 3, and it's taken me my third therapist to really get the right fit, and that's okay. But one of the best statements at one of the wellness conferences I went to pre-COVID, physicians have to find a therapist that they cannot outsmart, right?
That's right, because our masks are really well developed and are backed with a lot of words. And we also know all the right words to say, right? So,
That's right. We know how to pivot. We're trained in that ourselves, right? So,
and that's a two-way. I mean, let's be clear though, that's a two-way responsibility because there also has to be a willingness
absolutely.
to let that mask crack or to take it off as well. And that does require some time and trust.
Yep. And I think the trust that the foundation is building on a broader scale that's now translating on a micro scale is hopefully something, along with conversations like these, which I think are getting better and bolder as we keep moving forward. It'll enable more of us to embrace that and take the mask off. How is the foundation doing today? And what can physicians in Atlanta maybe start getting more involved with to help?
Yes. So we've talked a little bit about the problem. Now let's talk about how
Yeah,
we're trying to get to a solution, or at least
absolutely.
closer to a solution. So the foundation works in three ways: advocacy, collaboration, and advancing solutions. Okay. And so, in terms of advocacy, we work on the federal level. We had the passage of the Dr. Lorna Breen Healthcare Provider Protection Act in 2022. That's up for reauthorization right now. And that provides funding to healthcare organizations to advance their professional well-being programs, and also to the Impact Wellbeing Guide, which is a leader guide on how to improve the workplace environment for healthcare workers. So one call to action for Atlanta area physicians is write your legislator and write in support of the reauthorization of the Dr. Lorna Breen Act. And Dhaval, I can give you the links to all this if folks.
Absolutely. And honest, the MAA, the Medical Association of Atlanta, they do so much advocacy. This will be right up the alley. So
I love
we're going to
that.
add that in.
I love it. The second thing in terms of collaboration, we do on a national level and an individual level. So on a national level, we have our All In Coalition, which consists of 40 plus organizations that have a stake in healthcare. So that includes the AMA, the ANA, the AHA,
Mm.
IHI, EPIC. Okay.
Epic.
Yeah. So I would say they have a stake in healthcare, and they actually do have a physician well-being team. So, we bring these groups of folks together every other week for 5 years, and we break down the silos and what these organizations are doing on their own to help collaborate and inform each other and the work of the foundation. We also have over 400 ambassadors. I'm talking to one right now.
Yes.
Who are amazing individuals immersed in the work of professional well-being for healthcare workers across our country. And these are healthcare workers, their family members, survivors of suicide, leaders, and mental health experts. We also are trying to accelerate the adoption of best practices. And we do that in two ways. And I want to talk a little bit about the licensing and credentialing work separately, and then we can talk about caring for caregivers. So in 2022, we made a map for the first time of which states had medical licensing applications that were most consistent with best practice guidelines as set out by the AMA, the FSMB, so the Federation of State Medical Boards, and the Federation of State PHPs. And we found that there were 19. That was, by the way, just recently up from 17 in 2022. So we said, okay, these best practice guidelines have existed for years. This is a place that we can make an impact and bridge the implementation gap, right? There's a best practice, it's not being implemented, let's go. So we worked with our All In Coalition team, again, AMA, AHA, ANA, et cetera, to develop a badge, the All In Licensing and Credentialing Champions badge, and a map that tracks where these locations are. We update this map and we update the badge yearly and the map in May and September. So on September 22nd, the maps will be updated. And as of this September, we will have more than doubled the number of states. So we are in the last 10 states.
That's fantastic.
So in 3 years, we've seen tremendous change on this issue. And that is because of the action of advocates like yourself, advocates at the state level, advocates at the federal level, regulators, healthcare workers, and we have expanded this licensing champion challenge to nursing, to pharmacy, and to dentistry. And then we said, okay, where else do these questions get asked? Well, they get asked on credentialing applications, right? And so we've been working with hospitals and health systems to change their credentialing applications, re-credentialing applications, and peer reference forms to remove invasive and stigmatizing language around mental health and substance use disorder. So these are the look back questions, the have you ever been diagnosed or treated with questions, that are one of the top 3 reasons why healthcare workers do not seek mental health care. Right after, I can't get to a mental health care provider, and state licensing. So right along those, we have credentialing. And so we've been working with hospitals and health systems across the country to address credentialing. And that's my second call to action for the folks who are listening to this. Check out our maps after September 22nd. There's a map with bright blue on the states. You can click on Georgia. You can see which hospitals and health systems have received the badge. And if your hospital and health system isn't on that list, talk to your CMO, talk to your med staff services. Use our toolkit to audit and change your questions. Run them by us and then get them changed in your system, and we will happily badge you too. And you will join now more than 10% of hospitals and health systems in the country that have gone through this process. And that's almost 1,000 hospitals across the country now have gone through this process since we started it in 2023. So we're working with all of the licensing boards for physicians, nurses, pharmacists, dentists, and all of the hospitals and health systems across the country. And now we're starting to work with payers, and we're starting to work with malpractice insurers as well.
That's great. And I want to emphasize Georgia is one of those states that is doing the right thing, one of the earlier states that adapted, which is fantastic. And I'm so September 22nd, we'll be looking. Obviously, we have a lot of healthcare systems in Metro Atlanta and the surrounding areas. Some may be on it, some may not. And I think the only way it will continue to change is if we have physicians like yourself and me on the micro level, on the ground, front lines, really pushing and advocating for that change. And importantly, once that change is made, making it known, because it enables us that physicians actually do have a voice. We can do things for our profession, number one. And more importantly, number two, it gives us, those of us who are afraid, including myself at one point, of seeking help, that look, we are more protected than ever now. And none of this work it couldn't have been completed without the leadership of the foundation. So that's phenomenal progress. Do you find, Stefanie, that sometimes institutions are slower to adapt despite the states being already forward? I know we're still very in the infant stages of this, but I'm seeing that in a few different places. And it's nothing against institutions. I just think sometimes things are slower to change on the small micro levels, which frustrates me.
Well, I think part of the issue is there's only 50 states and there's over 6,000 hospitals.
Fair
So,
enough.
another way of looking at that is like we've been able to make this change in like 20 times the number of small institutions as we have states.
True.
So
True.
the overall, like for in any given institution, it can happen quite quickly. We've had a health system change this in 48 hours.
That's beautiful. I mean, that's beautiful.
It takes the right combination of people who totally buy in and understand and we've had organizations that have been working over the course of years to get this done and to work with their risk team, with their general counsel, with their med staff.
Yeah.
And then, it can be difficult. What I would say is that we offer ourselves as a resource in this. We have a toolkit, which is a very clear guide. And
Makes
then
it easy.
it makes it easy. And if there are reservations and any of the team members on the team, they need to talk to somebody, we also make that available as well. And now we've had many experiences talking to risk, talking to general counsels, and frankly, there is a risk to asking these questions that you're going to cause harm to an individual who doesn't get care because of the concerns of the question. And there's frankly also a risk of asking the question when you don't have a clear plan on what to do if the answer is yes. So, there's
risk both ways.
Risk. Well, and I would say, how many people are actually answering yes to these questions who don't have a clear support system and plan in place that you're actually
Yeah.
changing by asking the question. So I'm not even sure you're doing much good by asking the question at all. We are not seeing a difference or a change when organizations take this question out.
Yeah.
So yes, the change is happening at a pace hitherto unseen in healthcare, frankly. And we're looking forward to it to continue. And one of the things we've been doing to accelerate this pace of change is working with states as a whole. And so we have a program called All in Caring for Caregivers. It's going in Virginia, North Carolina, New Jersey, Wisconsin, where we work with states over the course of several years
Mm-hmm.
to do the licensing and credentialing as a state and a challenge across the state for credentialing. Then we do leader education about the systems approach to professional well-being. And then we form a learning collaborative in
Mm.
order to focus on a specific area of the operational environment and change it across the state. And so in Virginia, that was the electronic health record. And in North Carolina, we're working on bidirectional communication.
Wow.
Okay. And so those are the two that we're in that third phase with already. And so we're seeing case studies and implementations come out of these hospitals and health systems that are really closing that implementation gap for ideal practice environments.
Yeah, that's fantastic. That's fantastic. I know there's going to be a lot of physicians who are very excited by this conversation and can relate to it and want to get more involved. And we'll talk about that in a second. Before we start wrapping up, we were talking earlier, and I have to share that I personally have not feel this seen in healthcare since the last 5 years. The foundation really sparked the movement nationally during the time when we needed it the most. And that was one of the catalysts for me to share my story, write a memoir, give my proceeds back to the foundation, work as an ambassador. But I see other corporations, other companies, the Figs Scrubs company. This is not a paid advertisement, but they're doing phenomenal work in advocacy also.
You know that they made the tuxedo that Noah Wiley wore and when he accepted his Emmy last night?
I love that, by the way. I love that. I think they have a new line, a new clothing line, because I am all there for my next
I
tux
think
to be a
it
Figs
was a
tux.
one-off, but
I know. I saw that though. But speaking of the pit, that's a drama that came out just like a year and a half ago or so. And I watched the whole first season. I am not an ER physician, but can I tell you how much I related to so much of the innuendo? And a few weeks ago, you got to be, or maybe a few months ago, you got to be on Capitol Hill with Noah Wiley and that team. What was that like?
it's so gratifying to see people from across different industries understanding what healthcare workers are going through and raising their voices alongside us. I've been in this space of healthcare workforce well-being and um, professional well-being almost my entire career. From the time I was in residency, doing work around communication, culture of safety, professional well-being. And it was like we would be knocking on a heavy oak door, like,
Yep.
hey, there's
Yep.
people out here who are struggling, things
I
need to
know.
change. And then in the pandemic, like the door cracked open, and all of a sudden
Yeah.
people are poking their head out, going, "You guys okay out there?" And we're like, "No,
Yeah.
no."
We're actually not.
And
Yeah.
so I think what we've done is we've shoved our foot in that door, and we're not going to let it close. And there's other people who are coming along with us. So Noah Wiley was gracious enough to come in conjunction with FIGS to do a congressional briefing on Capitol Hill about the reauthorization of the Dr. Lorna Breen Healthcare Provider Protection Act. It was amazing advocacy day, and also, personally, it was thrilling to be able to meet somebody and speak with somebody who's using his platform
Yes.
to make such a difference for healthcare workers and to meet his mom, who's a 40-year nursing
I saw
veteran.
that.
So very cool, and nice to see them get the credit they deserve for that
Absolutely.
work. Can't wait for the second season, and particularly how they're going to handle the mental health care treatment sort of component of that.
Yeah, I think there's a lot more to come and a lot more discussion around that.
Mhm.
And I'm hopeful with the Medical Association of Atlanta, as we wrap up, we'll continue to have a space for this. The MAA is also tied in with Medical Association of Georgia. So I feel like the work is just getting started. And having you and talking to you today, Stefanie, Dr. Simmons, has been amazing and always invigorating. Every conversation I have with you, I just have a little extra kick in my step, keep going. We do want to remind that the MAA does offer LifeBridge Physician Wellness Program, which does offer 4 free counseling sessions to physician members. So that is a great resource. We'll include resources along with this webinar on the Dr. Lorna Breen Heroes Foundation, National Physician Suicide Awareness Day, and the LifeBridge program. And I'll include my personal contact information if there's a way we can connect directly anybody with the foundation and maybe grow more of us in Atlanta to align with the mission there. Dr. Simmons, thank you for joining us today. What a timely time to have you, and we hope to see you again soon.
Thanks, Dhaval. Take care.
Thank you.